Welcome to GoSharp's training on HIPAA, high-tech, and omnibus. As a healthcare professional, you've no doubt heard of HIPAA before. But what is HIPAA? And what do you need to know about it to perform your job correctly? HIPAA is an acronym that stands for the Health Insurance Portability and Accountability Act. This act is a series of national standards that healthcare organizations must have in place to safeguard the privacy and security of protected health information, also known as PHI. We'll get into PHI in more detail in a few minutes, but first, let's review the history of HIPAA and how it came to be. HIPAA is a United States Act of Congress that was signed into law by President Bill Clinton in 1996. Its primary goals were to improve the efficiency and effectiveness of the healthcare system by standardizing electronic data interchange and ensuring the security and confidentiality of patient information. Let's explore how this act has evolved since its inception in 1996. HIPAA's initial focus on implementation was to improve health insurance coverage continuity for workers and their families if they were to change or lose their jobs. But HIPAA provisions expanded with the privacy rule. This rule, finalized in 2000, established national standards for the protection of individually identifiable health information. It set limits on the use and disclosure of such information and gave patients rights over their health information, including rights to examine and obtain a copy of their health records and request corrections. Yet another rule made its entrance 3 short years later, the Security Rule, which became effective in 2003. Set standards for the protection of electronically protected health information, also known as ePHI. The Security Rule required covered entities to implement administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and security of ePHI. But that's not all. There are 3 more rules that have been enacted since 2003. The Enforcement Rule provided standards for the enforcement of all the administrative simplification rules. It outlined penalties for HIPAA violations and established procedures for investigations and hearings. In 2009, as part of the Health Information Technology for Economic and Clinical Health Act, the Breach Notification Rule was implemented. It required covered entities to notify affected individuals, the Department of Health and Human Services, HHS, and in some cases, the media, if there were any breaches of unsecured protected health information. Finally, the Omnibus Rule, effective in 2013, made significant modifications to HIPAA, including implementing provisions of the HITECH Act, which we will discuss in a later section. What is important to know about the Omnibus Rule is that it strengthened the privacy and security protections for health information and expanded the responsibilities of business associates. These milestones highlight HIPAA's evolution in response to changes in both the healthcare landscape and technological advancements. These regulations enforce the protection of patient information and improve the healthcare system's efficiency. HIPAA is a crucial piece of legislation that governs the privacy and security of individuals' protected health information. HIPAA prohibits healthcare providers and businesses, known as covered entities, from disclosing protected health information, PHI, to anyone other than a patient and a patient's designated authorized representatives. A provider or covered entity must have a patient's consent to disclose this information. So, what information would be considered PHI? PHI is any information about health status, provision of healthcare, or payment for healthcare that can be linked to a specific individual. Essentially, PHI is any identifiable information that can be used to identify a patient. Some common PHI identifiers include, but are not limited to, names, phone numbers, email addresses, and account numbers. In healthcare, there are 2 types of organizations that create or collect PHI and must be HIPAA compliant: covered entities and business associates of covered entities. Covered entities directly involved in the creation of protected health information, PHI, must adhere to all HIPAA regulations. HIPAA regulation defines a covered entity as healthcare providers, health plans, and healthcare clearinghouses involved in the transmission of protected health information. A business associate is any organization hired by a covered entity or another business associate who may encounter PHI over the course of the work they have been contracted to perform. Examples of business associates include electronic health record providers, medical billing companies, cloud storage providers, medical waste management services, and shredding services. This training will provide guidance on how to become HIPAA compliant, the permitted uses and disclosure of protected health information, how to protect that information, and what to do if a breach occurs. Let's take a closer look at the HIPAA privacy rules, which consist of several interlocking regulations: the privacy rule, the security rule, the breach notification rule, and the omnibus rule. Each of these rules plays a crucial role in safeguarding patient data and ensuring compliance with HIPAA standards. First, let's discuss the HIPAA privacy rule. The HIPAA privacy rule is a cornerstone of HIPAA regulations, establishing national standards for the protection of protected health information, PHI. All covered entities, including healthcare providers, health plans, and healthcare clearinghouses, must adhere to these standards in their day-to-day operations. To recap PHI, remember the following. PHI encompasses any information about a patient's health status, provision of healthcare, or payment for healthcare that can be linked to a specific individual. This includes a wide range of data, such as names, dates of birth, social security numbers, medical record numbers, addresses, phone numbers, email addresses, medical history, diagnoses, treatment information, test results, insurance information. What does the HIPAA privacy rule protect? The privacy rule safeguards PHI from unauthorized use or disclosure. This means that covered entities must implement appropriate safeguards to prevent the accidental or intentional release of PHI to unauthorized individuals or entities. It's important to distinguish between the use and disclosure of PHI. Let's take a closer look at each. Use refers to the internal handling of PHI within a covered entity. This includes sharing, employing, applying, utilizing, examining, or analyzing PHI for treatment, payment, or healthcare operations purposes. Disclosure refers to the release, transfer, or provision of access to PHI from the covered entity to an external party. This could include sharing PHI with another healthcare provider for treatment purposes, submitting a claim to an insurance company, or releasing PHI in response to a court order. The privacy rule sets strict limits on when and how covered entities can use or disclose PHI. Generally, covered entities must obtain the patient's written authorization before disclosing PHI for any purpose other than treatment, payment, or healthcare operations. However, there are some exceptions to this requirement, such as disclosures required by law or for public health purposes. By understanding the scope of the HIPAA privacy rule and what constitutes PHI, healthcare providers and business associates can ensure they are taking the necessary steps to protect patient privacy and comply with HIPAA regulations. The HIPAA security rule is a critical component of HIPAA regulations that focuses on protecting electronic protected health information, otherwise known as ePHI. ePHI is any PHI that is created, received, maintained, or transmitted electronically. The HIPAA security rule establishes a framework for safeguarding ePHI from unauthorized access, alteration, disclosure, or destruction. To achieve this, the security rule mandates that covered entities and their business associates implement appropriate safeguards in 3 key areas: physical, technical, and administrative safeguards. Physical safeguards are designed to protect the physical environment where ePHI is stored or processed. This includes measures such as facility access controls, workstation security, and device and media controls. Facility access controls involve limiting physical access to areas containing ePHI by using security systems like surveillance cameras, alarms, and keycard access. Workstation security measures must be implemented to secure workstations and devices used to access EPHI, such as automatic screen locks and secure disposal of electronic media. Device and media controls involve tracking and managing the movement of hardware and electronic media containing EPHI, as well as implementing secure disposal procedures. Technical safeguards address the technology and systems used to store, process, and transmit EPHI. This includes access controls, audit controls, integrity controls, and transmission security. Let's look at each one more closely. Access controls include measures taken that implement unique user identification, emergency access procedures, automatic log-off, and encryption and decryption of EPHI. Audit controls involve tracking and reviewing activity in information systems containing EPHI to detect unauthorized access or disclosure. Integrity controls help ensure that EPHI is not altered or destroyed in an unauthorized manner. Transmission security protects EPHI during electronic transmission by using encryption and other security measures. Administrative safeguards focus on the policies, procedures, and training that govern the management of EPHI. This includes 6 areas: security management processes, security personnel, information access management, security awareness and training, a contingency plan, and evaluation. Conducting risk assessments, developing and implementing security policies and procedures, and assigning responsibility for security to specific individuals are administrative safeguards that are part of a security management process. Designating a security official responsible for overseeing the organization's security program is an important personnel safeguard. Information access management involves implementing policies and procedures to control access to EPHI based on job roles and responsibilities. Security awareness and training is key and includes providing regular training to employees on security policies and procedures, as well as raising awareness about potential threats and vulnerabilities. Contingency plan is also necessary. By establishing procedures for data backup, disaster recovery, and emergency mode operation, organizations ensure continuity of operations in the event of a security incident or system failure. Regularly reviewing and updating security measures to address emerging threats and vulnerabilities is part of the evaluation process that serves as yet another administrative safeguard. By implementing a comprehensive security program that addresses these physical, technical, and administrative safeguards, healthcare organizations can effectively protect EPHI, maintain HIPAA compliance, and mitigate the risk of data breaches. Additionally, the HIPAA security rule requires covered entities to conduct regular risk assessments to identify and prioritize potential risks to EPHI. This allows organizations to allocate resources effectively and implement targeted safeguards to address the most significant risks. Now, let's discuss the breach notification requirements under the Omnibus Rule. The breach notification rule specifies the procedures HIPAA-covered entities must follow when a data breach occurs. This rule requires covered entities to notify each individual affected by a breach of unsecured PHI. Individual notice. Covered entities are required to notify individuals affected by a breach as soon as it is discovered. This notification must be provided in writing, either via first-class mail or email, if the individual has agreed to receive electronic notices. If the covered entity cannot reach 10 or more individuals due to insufficient or outdated contact information, they must provide a substitute notice. This can be done by posting the notice on their website's homepage for at least 90 days, or by issuing the notice through major print or broadcast media in the area where the affected individuals are likely to reside. The notice must include a toll-free phone number that is active for at least 90 days to allow individuals to confirm whether their information was involved in the breach. For fewer than 10 individuals with insufficient contact information, the entity may use alternative methods, such as another form of written notice, phone calls, or other means. These notifications must be sent without unreasonable delay and no later than 60 days after the breach is discovered. The notice should also include a brief description of the breach, the types of information involved, steps individuals should take to protect themselves, and what the covered entity is doing to investigate the breach, mitigate harm, and prevent future breaches. Contact information for the covered entity or business associate, if applicable, should also be provided. In cases where a breach occurs at or is caused by a business associate, the covered entity remains responsible for ensuring that notifications are sent to affected individuals. However, the responsibility for providing these notifications can be delegated to the business associate. Covered entities and business associates should decide who is in the best position to notify individuals, considering factors such as the business associate's role and which entity has the direct relationship with the affected individuals. Media notice. Covered entities that experience a breach affecting more than 500 residents of a state or jurisdiction are, in addition to notifying the affected individuals, required to provide notice to prominent media outlets serving the state or jurisdiction. This information is most often provided to medical outlets as a press release. Just like individual notices, this media notification must be provided without unreasonable delay and no later than 60 days following the discovery of a breach. The notification must include the same information that is required for the individual notices. Secretary notice. In addition to notifying affected individuals and, when necessary, the media, covered entities are also required to report breaches of unsecured protected health information to the Secretary of HHS. This is done by visiting the HHS website and completing an online breach report form. For breaches affecting 500 or more individuals, the covered entity must notify the Secretary without unreasonable delay and no longer than 60 days after discovering the breach. However, if a breach affects fewer than 500 individuals, the covered entity can report these breaches to the Secretary on an annual basis. In such cases, the report is due no later than 60 days after the end of the calendar year in which the breaches were discovered. Notifications by a business associate. A business associate is required to notify the covered entity of a breach without unreasonable delay and no later than 60 days after the breach is discovered. Whenever possible, the business associate should also provide the covered entity with the names of each affected individual and any other relevant information needed for the covered entity to include in its notification to those individuals. Administrative requirements and burden of proof. Covered entities and business associates are responsible for proving that all necessary notifications have been made, or that an incident involving the use or disclosure of unsecured protected health information did not qualify as a breach. In the case of an impermissible use or disclosure, the covered entity or business associate should keep records confirming that all required notifications were sent. Alternatively, they should maintain documentation showing that notification was not necessary, such as 1. A risk assessment demonstrating a low probability that the protected health information was compromised, or 2. Evidence that an exception to the definition of breach applies. Additionally, covered entities must adhere to specific administrative requirements related to breach notifications. This includes having written policies and procedures in place for breach notification, training employees on these protocols, and implementing appropriate disciplinary actions for workforce members who fail to comply with these policies and procedures. Business associates and HIPAA. The HIPAA Omnibus Rule also requires business associates to comply with HIPAA regulations and outlines the requirements for business associate agreements, BAAs. These agreements are contracts that must be signed between a covered entity and a business associate, or between two business associates before any PHI or EPHI can be shared or transferred. By adhering to HIPAA regulations, you safeguard not only the privacy and security of your patient's PHI, but also protect your business. If you are a healthcare provider or a vendor in the healthcare sector, it is crucial to understand the requirements for HIPAA business associates. A HIPAA business associate is any individual or entity that may access, handle, or manage protected health information, PHI, through their business dealings with covered entities. Essentially, if an organization is contracted to use, distribute, or access PHI, it is likely classified as a business associate under HIPAA regulations. Examples of HIPAA business associates include legal professionals, billing companies, web hosting services, and email encryption services. Business associates are required to comply with HIPAA regulations, which includes implementing safeguards to protect PHI and signing business associate agreements, also known as BAAs, with covered entities. These agreements outline the responsibilities and security measures necessary to ensure PHI remains protected. Understanding these requirements helps ensure compliance and protects both patient privacy and your organization's operations. Business Associate Agreements, BAAs, are required under the HIPAA privacy rule. A BAA specifies the permissible uses and disclosures of protected health information, PHI, by the business associate, outlines the measures for safeguarding PHI, and details the procedures for reporting any breaches of PHI. A BAA must include an acknowledgement that both the issuing organization and the signing business associate are subject to HIPAA regulations. This ensures that both parties understand their responsibilities under HIPAA and are committed to maintaining the confidentiality and security of PHI. If both organizations agree that they fall under HIPAA regulations, they cannot exempt themselves from liability by claiming they are not required to comply with these regulations. A well-drafted HIPAA business associate agreement plays a crucial role in protecting organizations from liability in the event of a breach. The agreement should explicitly delineate the responsibilities of each party in the event of a breach of protected health information. It must clearly specify that the BAA must be executed before any PHI is shared, exchanged, or transmitted between the organizations. This ensures that both parties understand their obligations and liabilities under HIPAA. If your business doesn't have appropriate business associate agreements in place, you are not HIPAA compliant. For this reason, covered entities and their business associates need to understand the risks of a PHI breach and the role each organization or individual plays in protecting PHI. Let's shift our focus to proactive measures that can help reduce the risk of data breaches. A crucial first step is to develop and implement policies, procedures, and standards of conduct tailored to your organization's specific needs and operations. This is essential because it establishes clear guidelines for the appropriate use and disclosure of protected health information, PHI, minimizing the chances of unauthorized access or accidental breaches. A crucial step in maintaining HIPAA compliance is designating a specific individual as the compliance officer. This person serves as the central point of contact for all matters related to HIPAA regulations within your organization. The compliance officer's responsibilities are multifaceted and encompass the following key areas: privacy, security, general compliance, education, and incident response. When it comes to privacy, a compliance officer oversees the implementation and enforcement of policies and procedures designed to protect the privacy of PHI. This includes ensuring that PHI is only used and disclosed as permitted by HIPAA, and that patients' rights to access and control their health information are respected. Compliance officers play a pivotal role in safeguarding ePHI by developing and maintaining a comprehensive security program. This involves conducting risk assessments, implementing physical, technical, and administrative safeguards, and ensuring that employees are trained on security protocols. The compliance officer is responsible for ensuring that the organization adheres to all aspects of HIPAA regulations, not just privacy and security. General compliance measures may include monitoring compliance with the breach notification rule, the HIPAA omnibus rule, and other relevant federal and state laws. In addition, compliance officers serve as a resource for employees and patients in the areas of communication and education. They answer questions about HIPAA regulations and provide guidance related to compliance issues. They may also conduct training sessions to educate staff on HIPAA requirements and best practices. In the event of a data breach or other HIPAA violation, the compliance officer leads the investigation and response efforts. This includes notifying affected individuals, reporting the incident to regulatory authorities, and taking corrective action to prevent future breaches. By having a dedicated compliance officer in place, organizations can ensure that they have the expertise and leadership needed to navigate the complex landscape of HIPAA regulations. This not only helps to protect patient privacy and maintain compliance, but also fosters a culture of compliance within the organization. To cover the full scope of HIPAA regulations, effective training must be implemented on an ongoing basis, at least annually. New hires must also be trained properly as part of the onboarding process. An open line of communication between the compliance officer and the organization is essential to ensure everyone understands their role in protecting PHI. The compliance officer must promptly address any concerns while fostering a culture of compliance within the organization. Regular updates, training sessions, and feedback mechanisms should be established to facilitate this communication. This open dialogue helps identify potential risks, prevent breaches, and maintain HIPAA compliance effectively. Policies and procedures should be regularly reviewed and updated to ensure they are being followed and remain effective. This could involve regular audits or spot checks to assess compliance. It's recommended to engage internal or external auditors periodically to evaluate the effectiveness of your policies, procedures, and controls. Your organization should have a clear disciplinary policy in place that outlines the consequences for violating HIPAA policies, procedures, or standards of conduct. This could range from additional training to termination of employment, depending on the severity of the violation and whether it was intentional or unintentional. In the unfortunate event of a data breach, having a robust incident response plan is crucial. This plan should outline the steps to be taken in order to contain the breach, investigate the cause, notify the affected individuals, and report the incident to the appropriate authorities, such as the Department of Health and Human Services, HHS, Office for Civil Rights, OCR. There are some additional considerations that should also be taken into account, such as risk assessments, data encryption, access controls, BAAs, and training and awareness programs. Let's take a closer look at each one. Risk assessments should be conducted regularly to identify potential vulnerabilities in your systems and processes. Data encryption is vital since strong encryption measures protect PHI both at rest and in transit. Access controls should be limited. Access to PHI should be limited to authorized personnel only, and everyone should use strong passwords and two-factor authentication wherever and whenever possible. Ensure that business associate agreements, BAAs, are in place with any third-party vendors or partners who handle PHI on your behalf. Ongoing training and awareness programs should be provided to employees and contractors to keep them informed about HIPAA regulations and best practices. By taking these proactive measures, you can significantly reduce the risk of HIPAA violations and protect your organization from the legal, financial, and reputational consequences of a data breach. Let's dive into these measures in more detail. When organizations need to gauge their level of HIPAA compliance, there are 6 main steps that your organization should take. First, the best practice is to start with a comprehensive risk assessment. This is not merely a recommendation, but a mandate under HIPAA, requiring covered entities and business associates to conduct annual audits. These audits are designed to pinpoint and evaluate any administrative, technical, or physical vulnerabilities that could compromise the privacy and security of protected health information, PHI. By conducting a comprehensive risk assessment and implementing these additional measures, organizations can proactively identify and mitigate potential risks to PHI, which demonstrates their commitment to safeguarding sensitive patient information and maintaining continuous compliance with HIPAA regulations. The next step involves creating remediation plans. After these covered entities and business associates identify gaps in compliance through self-audits, they must implement remediation plans to address and correct any compliance violations. These remediation plans must be fully documented and include specific calendar dates by which the identified gaps will be addressed. After this step, it is important to establish policies and procedures. Covered entities and business associates must develop policies and procedures that align with HIPAA regulatory standards. As outlined by the HIPAA rules, these policies and procedures must be regularly updated to reflect any changes within the organization. Additionally, annual staff training on these policies and procedures is required, along with documented employee attestations confirming that they have read and understood each of the organization's policies and procedures. Step 4 involves documentation. Organizations subject to HIPAA must document all efforts they have taken to achieve HIPAA compliance. This documentation is crucial during a HIPAA investigation by the U.S. Department of Health and Human Services, or HHS, as it helps ensure that the organization can pass rigorous HIPAA audits. Step 5 involves business associate management. Covered entities and business associates must document all vendors with whom they share PHI in any capacity and execute a business associate agreement, also known as a BAA. These agreements must be signed before any PHI is shared, ensuring that PHI is handled securely as well as mitigating liability. Step 6 involves incident management. If a covered entity or business associate experiences a data breach, they must have a process in place to document the breach and notify affected patients that their data has been compromised in accordance with the HIPAA Breach Notification Rule. The HIPAA Breach Notification Rule requires covered entities and their business associates to notify affected individuals, the U.S. Department of Health and Human Services, HHS, and in certain circumstances, the media, of a breach of unsecured protected health information, PHI. The key components of incident management include the following 6 components: breach identification and documentation, risk assessment, notification to affected individuals, notification to HHS, notification to the media, and mitigation and corrective action. 1. Breach identification and documentation is the first component. Covered entities and business associates must promptly identify potential breaches of PHI. Once a breach is suspected, it must be thoroughly documented, including details such as the nature of the breach, the types of information involved, and the individuals affected. This documentation is vital for internal assessment and for any subsequent investigation by HHS. 2. The second component is a risk assessment. A risk assessment must be conducted to determine the likelihood that the PHI has been compromised. This assessment considers factors such as the type of information disclosed, the nature of the breach, the risk of harm to the affected individuals, and whether the information was actually acquired or viewed. 3. Notification to affected individuals is mandatory. If it is determined that a breach has occurred, affected individuals must be notified without unreasonable delay and no later than 60 days from the discovery of the breach. The notification must include a description of the breach, the types of information involved, the steps individuals should take to protect themselves, what the covered entity is doing to investigate and mitigate the breach, and contact information for further inquiries. 4. Notification to HHS is also required. Depending on the number of individuals affected, the breach must be reported to HHS, either immediately or at the end of the calendar year. An exception to this is for breaches affecting 500 or more individuals. These must be reported to HHS and the media within 60 days. 5. Notification to the media may be necessary as well. For breaches involving more than 500 residents of a state or jurisdiction, the entity must notify prominent media outlets in the area, which serves as a public notice of the breach. 6. Mitigation and corrective action must be taken after any breach. Entities must take steps to mitigate the harmful effects of the breach, prevent future incidents, and review their policies and procedures to ensure compliance with HIPAA regulations. This may involve providing additional training to employees, enhancing security measures, or implementing new technologies to better protect PHI. Incident management is a critical aspect of HIPAA compliance, as it not only helps protect patient information, but also ensures transparency and accountability in the event of a data breach. Proper incident management can significantly reduce the potential damage caused by a breach and demonstrate a commitment to protecting patient privacy. The Health Information Technology for Economic and Clinical Health HITECH Act was enacted in 2009 as part of the American Recovery and Reinvestment Act. HITECH is a significant piece of legislation aimed at promoting the adoption and meaningful use of health information technology, otherwise known as HIT, in the United States. Here's a breakdown of its key components and implications. There are 4 major goals of the HITECH Act, which offer incentives, strengthen the Act, increase penalties, and facilitate the exchange of information. The first goal is to incentivize the adoption of electronic health records, or EHRs. The HITECH Act provided financial incentives to healthcare providers and hospitals to adopt and demonstrate meaningful use of certified EHR technology. This encouraged the transition from paper-based to electronic health records, leading to improved efficiency, quality of care, and patient safety. Another goal was to strengthen HIPAA privacy and security rules. The HITECH Act strengthened the existing HIPAA regulations by extending the reach of the security rule to business associates of covered entities, requiring them to comply with HIPAA standards. It also introduced the breach notification rule, mandating the reporting of data breaches affecting 500 or more individuals. The HITECH Act also increased penalties for HIPAA violations. The Act introduced a tiered penalty structure for HIPAA violations, with fines ranging from $100 to $50,000 per violation, depending on the level of culpability and the number of violations. Finally, HITECH promotes health information exchange. The HITECH Act encouraged the development of health information exchanges, or HIEs, to facilitate the secure sharing of patient data between healthcare providers, which both improves care coordination and reduces duplication of services. There are several key provisions of the HITECH Act. Meaningful use is one provision that established a set of criteria that healthcare providers had to meet to demonstrate the meaningful use of EHRs and qualify for incentive payments. Breach notification mandates the timely notification of individuals and the Department of Health and Human Services, HHS, in the event of a data breach. Business Associate Agreements, BAAs, requires covered entities to have BAAs in place with their business associates, holding them directly accountable for HIPAA compliance. Access and accounting of disclosures gives patients the right to access their electronic health records and request an accounting of disclosures of their PHI. Finally, enforcement is a provision that increases the enforcement authority of the Office for Civil Rights, OCR, to investigate HIPAA complaints and impose penalties for violations has increased. The HITECH Act has certainly made a significant impact on the healthcare industry by accelerating the adoption of EHRs and promoting the use of health information technology. And even though the incentive program for EHR adoption has ended, its legacy continues through the strengthened privacy and security protections it put in place. The HITECH Act laid the foundation for the continued advancement of health information technology and its integration into healthcare delivery. However, there are still several ongoing challenges. While the HITECH Act has achieved many of its goals, challenges remain, including interoperability, data security, and patient privacy. The seamless exchange of health information between different EHR systems and providers remains a challenge, making interoperability an obstacle. The increasing digitization of health data has also increased the risk of cyber attacks and data breaches, making data security more of a challenge than ever before. Striking the right balance between data sharing for improved care coordination and protecting patient privacy also remains an important concern. Despite these challenges, the HITECH Act has undoubtedly played a crucial role in transforming United States healthcare into a more digital, efficient, and patient-centered system. HIPAA Omnibus Rule. The HIPAA Omnibus Rule, which took effect in 2013, is a set of modifications to the Health Insurance Portability and Accountability Act, HIPAA, Privacy, Security, and Enforcement Rules. It was enacted to strengthen patient privacy protections and enhance the enforcement of HIPAA regulations. Let's discuss the key provisions of the HIPAA Omnibus Rule. 1. First, there is increased liability for business associates. Business associates of covered entities, such as healthcare providers, health plans, and healthcare clearinghouses, are now directly liable for compliance with HIPAA security rule requirements. This means that they are held to the same privacy and security standards as covered entities and can face penalties for non-compliance. 2. Patient rights have been expanded under the Omnibus Rule when it comes to access to their health information and control over its disclosure. Patients have the right to receive electronic copies of their medical records and to restrict certain disclosures for marketing or fundraising purposes. 3. Breach notification requirements are now stronger. The rule clarified and strengthened breach notification requirements, requiring covered entities and business associates to notify affected individuals and the Department of Health and Human Services, HHS, of data breaches involving 500 or more individuals. 4. The Omnibus Rule introduced marketing and fundraising restrictions. The Omnibus Rule imposed stricter limitations on the use and disclosure of protected health information, PHI, for marketing and fundraising purposes. Covered entities must obtain written authorization from patients before using their PHI for marketing communications. 5. Genetic information protection was included. The Omnibus Rule extended HIPAA protections to genetic information, prohibiting health plans from using or disclosing genetic information for underwriting purposes. 6. Enforcement plays a bigger role as well. The Omnibus Rule enhanced HIPAA enforcement by increasing penalties for non-compliance and expanding the authority of the HHS Office for Civil Rights, OCR, to investigate and enforce HIPAA violations. The HIPAA Omnibus Rule significantly impacted the healthcare industry by strengthening patient privacy, increasing accountability, and enhancing enforcement. Now, patients have greater control over their health information and are better protected from unauthorized disclosures. Business associates are now directly liable for HIPAA compliance, leading to greater accountability and a more secure environment for patient data. The stricter enforcement provisions of the Omnibus Rule have deterred HIPAA violations and encouraged greater compliance throughout the healthcare industry. So, what are some key takeaways from this information? First, the HIPAA Omnibus Rule is a crucial set of modifications that significantly strengthen patient privacy protections and enhance the enforcement of HIPAA regulations. It holds both covered entities and business associates directly accountable for HIPAA compliance and imposes stricter penalties for non-compliance. The rule expands patient rights regarding access to their health information and control over its disclosure. It imposes stricter limitations on the use and disclosure of PHI for marketing and fundraising purposes. The Omnibus Rule extends HIPAA protections to genetic information and enhances enforcement mechanisms to ensure greater compliance with HIPAA regulations. By understanding and complying with the HIPAA Omnibus Rule, healthcare organizations can better protect patient privacy, build trust with their patients, and avoid costly penalties and reputational damage. In conclusion, understanding and adhering to HIPAA, the HITECH Act, and the Omnibus Rule is paramount for anyone working in the healthcare industry. As previously mentioned, HIPAA, the Health Insurance Portability and Accountability Act, establishes the foundation for protecting patient privacy and the security of their health information. The Health Information Technology for Economic and Clinical Health Act, known as HITECH, further strengthened these protections by incentivizing the adoption of electronic health records and introducing stricter penalties for noncompliance. The Omnibus Rule expanded upon these regulations, holding business associates directly accountable for HIPAA compliance and increasing patient rights. As healthcare professionals, HIPAA plays a vital role in your daily lives. It governs how you collect, store, use, and disclose protected health information. This means that every interaction you have with a patient, from taking their medical history to sending a referral, must be conducted in accordance with HIPAA regulations. This includes obtaining proper consent before sharing PHI, ensuring that PHI is only accessed by authorized individuals, and taking steps to safeguard electronic PHI from unauthorized access or disclosure. By understanding and adhering to HIPAA regulations, you not only protect your patient's privacy, but you also help to maintain the trust and confidence they have in the healthcare system. Failure to comply with HIPAA can result in serious consequences, including fines, legal action, and damage to your professional reputation. For these reasons, it is essential that you stay informed about HIPAA regulations and best practices, participate in ongoing training, and seek guidance from your compliance officer or other resources if you have any questions or concerns. By doing so, you can ensure that you are fulfilling your ethical and legal obligations to protect patient privacy while maintaining the highest standards of professionalism in your practice. Remember, HIPAA is not just a set of rules. It is a commitment to safeguarding the sensitive information that patients entrust to you. By taking this responsibility seriously, you can help to create a healthcare environment where patients feel confident that their privacy is protected. Thank you for watching our guide on HIPAA, HITECH, and Omnibus. We hope you found it helpful, and make sure to stick around to complete your assessment.